Aloha guys, this is Dr. Tom. I'm coming back at you. Yes, this is week 5. Our topic today is oncology, which is the medical specialty that deals with cancer. Cancer is a terrible thing, guys. It's the second leading cause of death in industrialized and modernized nations. All right, we're going to move fast. Some things I'm going to skip over and let you read over on your own. All right, cancer is characterized by unrestrained and excessive growth of cells. Instead of only reproducing so many times, they reproduce continually. Malignant tumors compress, invade, and destroy surrounding tissue. Cancer is responsible for 20%, of all the deaths in the United States. However, more than half the people who develop cancer are cured. I don't know if I'd agree with that, but we'll go with it. All right, we'll go over this later. Suffixes, let's see, blastoma, Genesis. Just remember Genesis in the Bible, starting something almost tumor, but it doesn't necessarily mean a cancerous tumor. It can be a benign tumor. Suppression therapy, epi means on top of, meta means change, neo means new. Tele, okay, I wish they had it spelled out better for us. Adjuvant chemotherapy, assisting primary treatment. Alkylating agents, synthetic chemicals that attack DNA. One of the primary goals, guys, with cancer is to stop it, is to interfere with its DNA or damage it in some way where it stops reproducing. Anaplasia, loss of a differentiation of cells. We want cells to be differentiated. Cancerous cells are undifferentiated to some degree. Angiogenesis is the formation of new blood vessels. This is important, guys, because cancerous tumors, some can can secrete chemicals that increase their own blood supply. So it's like an invading army with a nice supply line behind it. So they can actually influence how much blood they're getting so they can keep growing. Antibiotics, chemicals produced that inhibit the growth of cells. Yeah, primarily they kill off bacteria, but there's some used in cancer treatment too. Antimetabolites, chemicals that prevent cell division. Of course, that unwanted cell division, guys, is what we're wanting to stop. Antimitotics, drugs that block cell division, another one. Apoptosis, programmed cell death. This is important, guys. We have a lot of cells in the body, a lot of different kinds, and many of them are programmed to only reproduce a certain number of times and then to die. That's what they're supposed to do. So that acceptable death as part of the mechanism is called apoptosis. Okay? A benign tumor is a non-cancerous tumor. The more technical term is a neoplasm. So there's malignant neoplasms, or cancerous, and there are benign neoplasms. Biological response modifiers to normal fight cancer. Okay. The immune system, guys, has among its many functions is to help protect against cancer. Biological therapy, body's own defenses to destroy tumor cells. Brachytherapy, use of radiation placed directly in or within the cancer. On or within the cancer. There's different kinds of radiation therapy, guys, for cancer. Excuse my nose itches. Brachytherapy is like for example, in prostate cancer with men, they'll inject in the prostate gland these little seeds, look like kernels of rice that are radioactive, and they treat it from the inside out. Carcinogens, agents that cause cancer. Sunlight, tobacco smoke, different chemicals, a lot of different things. Carcinoma, this is real important. Cancerous tumor of cells of epithelial origin. Does everybody remember what epithelium is? This is the largest branch of cancer, are carcinomas. Cellular oncogenes, pieces of DNA that might cause a normal cell to become malignant. Chemotherapy, treatment with drugs, primarily with cancer. There's basically 3 ways they treat cancer, guys, for the most part. With surgery, chemotherapy, and radiation therapy of different kinds. And it depends on the type of cancer that you have. Oncologists are doctors who specialize in that. And it's very sophisticated. They have a great deal of experience, and they don't get the kind of results they'd like to get, but hopefully continue to improve. Combination chemotherapy, just a number of different chemos. We mentioned this one, dedifferentiation. DNA, the genetic material, is encoded in DNA in the nucleus of the cells. Differentiating agents that promote tumor cells to die. Drugs that promote tumor cells to die. Okay. Well, that's good. Differentiation, specialization of cells. Electron beams, low energy beams of radiation for treatment of skin or surface tumors. Encapsulated. Benign tumors are encapsulated, which is a good thing, guys. They have a capsule around them, so there's much less tendency for them to break loose and spread and metastasize. And that's one of the things that makes them benign, is that they're often encapsulated. External beam irradiation, applying radiation to a tumor from source outside of the body. I've had family members who had to have this done, guys, and they're very skilled at it. Now, it has some side effects and all, but with cancer, guys, you can't fool around, or it will get you. I don't agree with some of the conventional treatment for it, but I think it's the best we have under the circumstances. Fields, dimensions of body areas undergoing irradiation. So, for example, my mother had cervical cancer and eventually died from it. And she had a series of radiation treatments. And they actually tattoo, they take very careful measurements and put little tattoos on the skin. That's the way they did it now, 20-something years ago, to be able to focus that radiation exactly where they wanted it to go. Because it's very damaging, guys, so we want to minimize exposure to healthy tissue. Fractionation, giving radiation small repeat doses, which is what they do. Genetic screening, testing family members to determine if they have inherited a cancer-causing gene. There are some genes, guys, that lead to cancer. Not all cancers, but some. And you can be tested now to see if you have those genes. Grading tumors, evaluating the degree of maturity of tumor cells. Gray, unit of absorbed radiation dose, gray, okay. I always heard it called something different, okay. Gross description of tumors, the visual appearance, what they look like when you just see them with your unaided eye. Infiltrative, extending beyond normal tissue boundaries into adjacent tissue. Invasive, having the ability to enter and destroy surrounding tissue. That's a lot of the problems, guys, with cancer, is that it continually reproduces, which takes up enormous energy and resources, and then it grows and it starts invading healthy tissue and causing problems, or it breaks loose pieces that float downstream in the lymphatic or circulatory system and seed and make new colonies. That's metastasis. So it's a difficult treatment to deal with. Irradiation, exposure to any form of radiant energy such as light, heat, or X-rays. Linear accelerator, I don't know why they would put that in there, I'm sorry. Device that produces X-ray beams for treatment of deep-seated tumors. Okay. All right, now here's an important one. Malignant tumor, of course, is a cancerous tumor. The word malignant means cancerous. You might as well, if you don't know it already, get it down right now. Malignant tumor has characteristics of continuous growth, invasiveness, and metastasis. Those were the three things I just mentioned. Mesenchymal's embryonic connective tissue. Some cancers are inherited, yes, or born with it. Metastasis, the spread of malignant tumor to a secondary site. Microscopic description of tumors, appearance of tumors when viewed under a microscope. Mitosis, we know what that is, regular cell division. Cancerous cells undergo that as well, they just do it too much, they don't stop. Mixed tissue tumors, tumors composed of different types of tissue, which some are. Modality, a method of treatment. That's a general term, guys. In this case, they're saying, well, surgery, chemo, or radiation, or irradiation. But it can mean physical therapy treatment all too. Molecularly targeted therapy. Anti-cancer drugs designed to block the growth pathways in specific tumor cells. Morbidity, condition of being unwell. Mucinous, containing mucus, like mucous membranes. Mucus is gross, but it serves an important function. Mutation is a change in DNA. Most mutations are not good, but sometimes they are. Neoplasm is new growth. It can be benign, or it can be cancerous. Nucleotide, unit of DNA composed of a sugar, phosphate, and a base. It's part of the inner working of DNA. Oncogene, region of DNA in a tumor cell or in viruses that causes cancer. Yes, some viruses, guys, can cause cancer. Palliative, any kind of treatment, guys, that makes you feel better, makes the patient rest more comfortably, etc. is palliative. It doesn't cure, but it's still a place. You know, for example, a patient who's under hospice care, where they know they're not going to get better, they're going to die, and they give them palliative treatment. They give them morphine and other things to help them keep them as comfortable as they can, you know, which is the least you can do for these folks, right? Pedunculated means on a stalk or a stem. Photon therapy. Photon is a particle of light. Radiation therapy using energy in the form of X-rays or gamma rays. X-rays are light too, guys. They're just high energy light, much higher than what the visible light that we can see. Protocol is a detailed plan for an illness. Proton therapy. Protons are part of the nuclear particles of matter. Use of protons to deposit a dose of radiation at a focus point in the body. Radiation, energy carried by a stream of particles. Radiocurable tumor. Tumor destroyed by radiation therapy. A lot of this stuff works quite well, guys, but it also, sometimes it doesn't, and it often has some pretty rough side effects. Radio-resistant tumor is a tumor that is not easily treated with radiation. It has to be zapped. Radiosensitive tumor, radiation that causes death to cells without damage to surrounding tissue. That, guys, is the goal in cancer treatment, is the ability to destroy just the cancerous tissue and leave the other non-cancerous alone. And they're getting better at it all the time, but we still don't have it. Drugs, let's see, radiosensitizers. Drugs increase the sensitivity to tumors. Why is that important, guys? Well, if you treat it with this drug and it makes it more sensitive, then it takes a lower dose of radiation to destroy the cancer, which is good for the rest of the body also. Radiotherapy treatment tubes you don't, okay, relapse. Unfortunately, it's when the tumor or cancer comes back. And unfortunately, oftentimes it does, yes. But oftentimes it doesn't too, so. Remission, that's an important word. Partial or complete disappearance of symptoms of disease. Oftentimes a cancer patient will eventually go into remission. And sometimes they stay that way forever, which is basically they're cured. But sometimes it comes back. RNA, cellular substance that represents a copy of DNA. Yeah, we'll go with that. Now, we mentioned earlier that carcinoma is the largest category of cancers in humans. The next one is sarcoma. Carcinomas are derived from epithelial tissue. Sarcoma is derived from connective tissue, like muscle and bone and cartilage. There's far fewer of them, but there's still cancer, it's still serious. Serous, having appearance of thin watery fluid, which is what serous fluid is. Sessile means having no stem. Simulation, study using CT or MRI to map treatment before the radiation treatment is given. Okay. Solid tumor. Tumor composed of a mass of cells. Because some tumors aren't solid, guys, like leukemia, cancer of the white blood cells, for example, or multiple myeloma. Okay. Staging of tumors is a system of evaluating the extent of the spread of tumor. This is actually quite complex. It's one of the things that the oncologists do. Stereotactic radiosurgery, delivery of dose radiation under stereotactic guidance. Okay. Steroids, complex naturally occurring chemicals derived from cholesterol. Surgical treatments to treat cancer methods. Well, yeah, I'm not going to read that. Viral oncogenes, piece of DNA from viruses that infect a normal cell and make it malignant. A virus, infectious agent that reproduces by entering a host and then forcing it to make a copy of itself, many copies. Most biologists, guys, do not consider viruses to be living things because they don't reproduce in any of the normal manner. They reproduce like what we said right here. We're almost out of time here. Here's showing the difference between benign neoplasms and cancerous ones. And the main one is, look, cancerous is rapidly multiplying, invasive, infiltrative, anaplastic, undifferentiated, and tends to spread. Where benign, slow growing, encapsulated, and so on. Okay, guys, we're going to pick up right here with the next video. So Dr. Tom's going to sign off, and we'll see you shortly.